You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co host, we interview the innovators every week on this show. Super excited to introduce today's guest, but I'm not going to do that. Why don't you do that, Ivan?
Why don't I do it every week?
Let's try something
I'm
new.
I'm excited to introduce a colleague of mine, Dr. James Barr. He comes from Mars Science and Diagnostics. As a chief medical officer of Mars Pet Care Science and Diagnostics Division, Dr. James Barr oversees the quality organization and leads medical care for the global Antech veterinary diagnostic business. Most recently, he served as Blue Pearl's chief medical officer since 2018, where he helped establish the board of chief veterinary medical officers, a collective of over 60 top veterinary leaders from various industry segments. Dr. Barr currently serves as a chair of the board of chief veterinary medical officers. He holds undergraduate and veterinary degree from Louisiana State University, completed his emergency and critical care residency at Angel Animal Medical Center, worked at Blue Pearl starting 2007, and served on the faculty of Texas A&M University before joining Blue Pearl leadership. Dr. Barr, thank you for finding the time. Thank you for joining us.
It's my pleasure. Thanks for having me.
So, at that level where you are, what does that look like to allocate time to innovation? And because that's the big thing, whenever I think about these massive organizations, which Mars being the biggest, I don't think I'll over exaggerate, it's the biggest in the world. So you're in charge of innovation. And my experience at IDEX, for example, when I ran the software division, it was a nightmare of just trying to kind of get through the day because the amount of attention and how little attention you can spend with everybody. So where in your kind of day-to-day life, what does it look like? How do you think of these things and then implement? Because there's no really, how does that work?
Yeah.
Tell us.
Well, that's easier said than done, because no 2 days look the same, depending on kind of what's happening. I mean, I'm fortunate to be able to sit in the seat that I do because I get to work with a lot of really smart and innovative people. From my perspective, to be innovative, you have to be intentional. So you got to make sure that it is part of, how you think about problems, just instead of it's very easy to fall into that rut of solving problems the way that we always have. But if we want different results, then we're not going to be able to do that with the same solutions. And so fortunately, I sit in a seat where it's not finding a lot of good ideas. There are tons of good ideas. It's all around prioritization and being able to bring those to life. That's the real sort of challenge, I think, from my perspective. We have the way that Mars Science and Diagnostics is arranged, Antech Diagnostics that sits there, and there's a research and development group that really, tries to take ideas and bring them into life. And then also there's the Waltham Pet Care Science Institute that's been innovating and discovering for 60 years. And so there's constantly this underlying of culture of innovation, which is a really great place to be. I get to kind of, help to sort through all of those.
That's amazing. So, James, we had Neil Shaw on the podcast a couple of weeks ago. Neil's a great guy, great innovator, and he's running around chasing big dreams from a radiology perspective, and interesting kind of parallel with your seat now, potentially. This world of AI, it's so rapidly changing. People are trying to get their hands around it. How are you guys approaching it at Mars, and particularly in your seat? What's it look like for you guys?
Wow. I mean, I feel very fortunate, and I hope you guys do, to be able to be in veterinary medicine at this time, because this is a really exciting time to, be a part of this profession, because there is so much innovation and AI is at the forefront of that, and from my perspective, it's not a question of how we do AI. It's to what degree, because I think that, AI is going to become pervasive across all of our offerings, and it's going to be part of our world, whether we like it or not. And so the question is, how do we harness that to give real solutions? And so the way in which we're approaching it is largely in a practical way. So meaning, we want to find solutions to problems that actually exist within veterinary medicine. And so making sure that it augments that relationship between a veterinarian and a client and that patient and make that more efficient, a richer interaction with increasing the quality of that. I mean, but in a very practical sense, there's a lot of different things that can be done, but, does it really impact that care delivery? And that's where we're focused at right now.
Yeah, so that's amazing. Sounds really interesting. Sounds like a lot of moving pieces. I was recently at a forum that the Veterinary Innovation Council put on at AVMA, and there was lots of conversation around AI, lots of conversation around innovation, and there was this kind of theme that emerged where I was on the right side of it. We do, us because Blue Pearl used to use Talkatoo or uses Talkatoo still, and you were there for that transition. But the interesting thing about what came up at this meeting was if you are creating documentation that has to be reviewed, nobody has any problem with it. But if you're generating a diagnostic tool that people are going to use to make decision making on, people were up in arms about these types of tools being used and relied upon heavily. Where do you guys view the world when we look at these two different pieces?
It's amazing provocation because I'm a clinician, right? So I'm a criticalist. And so I have this emergency critical care slant to almost everything that I do. And so consequently, it's, very practical in orientation. But, I view this as these are all tools that we'll be able to use more and more. It's going to be involved in everything that we do. And I do agree to some, to some degree that there is going to be still, we're a long way away from a computer being able to replace the judgment and context that a human can do. And, in my view, it's not about replacing the judgment of veterinarians, but it's giving cognitive aids, it's giving prompts, it's giving the things that need to, that allow you to be able to practice that, the art component of medicine without, while having more data than you had before, which I think is a really positive thing, honestly. And so, I try not to get kind of caught up too much because ultimately the veterinarian at this stage in the world in which we are right at this moment, the veterinarian is still responsible for the decisions that are made on a case. Which tools you use to be able to make that, I think, is up to you. For me, it would be amazing to have a situation, I can think back to some of the mistakes that I made, in not recognizing diagnoses, early on in my career. And it's oftentimes that differential diagnosis didn't come up in your mind, in that area. And, if you can have those prompts to be like, an azotemic animal is not always something, it's not always in renal failure. Sometimes it can have Addison's disease too, right? So like having that prompt would be exceptionally helpful. And from my perspective would be, it actually enables the art of medicine more than it does replace it, if that makes sense.
I'm looking at the AI the same way. It's not replacement, it's a faster and more effective enablement of everything that the professional can do. And that's really, everybody who is scared of AI and it's going to replace us and everything else. I think it's just that anything that you do, you could be doing more efficiently, more accurately, and just do more of because technology can enable that.
Of course. Yeah, of
And,
course. And
and
radiology is a good spot. I mean, that's actually a perfect example of that, right? I mean, the nice thing about the technology that exists, Antech has rapid read. That's a part of Antech imaging services, but it highlights an area in which you may have missed, you may have gone over, and it says, what about this area right here? Well, what about that? And it allows you to sort of ask a deeper question, which I really appreciate.
So let's peel back the layers of the onion. What excites you like crazy that you guys are working on right now that you want to share with our audience?
Yeah, there's just a couple of things. I mean, I think we've got a lot of things sort of going into sort of innovative space that are on market right now. NuQ is one. And every time I think about some of the innovations that we're going through, that we have on market, and well, not just us, but in veterinary medicine, I feel like I'm living in the future. Between NuQ, which I mentioned, which is an amazing technology. Rapid Read, which, uses AI to be able to help discern and highlight, abnormalities on radiographs. But, there's also things like our key screen technology, which is a PCR based technology that detects, intestinal parasites. That is, I mean, I don't want to oversell here, but it's way better than a fecal flotation at being able to detect things. And so it's really sort of shifting a paradigm of, you not only have the application of these new technologies, but it really helps you to be more thorough. And that's the part that I think is really amazing to me, because it doesn't replace anything that a veterinarian does. It just enables a better level of care. That part is exciting to me. But, there's always going to be, things are going to become faster, more efficient, and so in addition to the technologies that are existing, how are we going to interact with those in the future? So what does it look like in the future? How we're going to actually be able to access that data? To me, that is going to be one of the biggest things. I have these dreams of something that pulls together, the whole clinical picture, so natural language processing of figuring out like, historical information along with lab work, along with radiology, along with all of these things pulled together that will really enable us to be able to diagnose our patients quicker and more efficiently.
The I think it's Steve Jobs said, or I don't remember. I think he did that. The way that they were able to accomplish so many things was not, amount of things that they said yes to, but the amount of things that they said no to. So at your level, I'm sure that you're thrown 55 ideas a minute. And you are there probably one of the decision makers, or probably the decision maker, of saying this is what we will say yes to and bring it to fruition. How does that work in what you do to select that right thing? And I'll put a spin on it too. There's one thing is probably strategy of the company and the focus, but also the incredibly fast evolving innovation in which you can actually miss something when you say no to something that is our future. So what does that look like, and how do you do that?
That's always the challenge, is to balance what can we accomplish versus what's possible, and I think that, fortunately, I think you nailed it. I'm not the only stakeholder when it comes to making a lot of decisions that I would give my input. There's a sort of a group that sort of runs what we call our stage gate process, where we have all these great ideas that are sort of entered in on one end, and then at the end, hopefully we would have, products that would come out that would be beneficial for the profession. And so you've got to be really dedicated and disciplined when it comes to evaluating, the organization's capacity to be able to sort of manage some of these changes, but also, is it going to matter to people? Is it going to impact a large enough audience? That kind of stuff. You have to think through what that is. And, you're exactly right. The art of strategy is what you say no to, not what you sort of let pass. Because when you try to do too many things, that means you don't do many of them well. And so there's a consensus based group of how we decide on innovations and how those sort of move through that process, which is relatively well thought out. But it's something that you have to be really intentional about, just dogged dedication to what can we bring to fruition, or else it's not going to be impactful.
So then, as a segue there, what do you say yes to strategically? What is Mars is focusing in this environment right now? The environment changed too. It recently, the whole, especially in the corporate world, where it was this rapid acquisition mode and stack EBITDA, expand, expand, expand. Where again, I don't know how much it touched Mars because of the different sort of the whole ownership and everything, but and also in the environment where we have veterinarians disappearing, not adding. So, what is the focus of Mars these days on kind of adapt to what's happening with the industry, and what are the interesting trends that you're seeing?
Boy, that is a huge question there, because, Mars is a really, large organization. I'll speak to Mars Pet Care. We have a very simple mandate. It is a better world for pets. That's what we do. And so if it does not create a better world for pets, then we don't do it. That's our mission. the different divisions within Mars Pet Care. So Mars Veterinary Health is one of them, which contains all the clinical practices, and then the science and diagnostics area, and then there's Roy Cannon and pet nutrition areas that are there. So we have nutrition focus and then care focus, and so where I sit is that sort of diagnostics and science space, and so that's our focus in Mars Pet Care in general. When we think about innovation and how we're going to sort of arrange ourselves, it's you've got the sort of the big focuses right now. Those focuses are healthy weight, dental disease, and dermatologic disease. So that's kind of how we're when we're thinking about innovations and the problems we want to solve, we do that are aimed towards those particular areas. However, it's the how we get that done that I think is the big kind of differentiator for us. I mean, because we have a really big focus on solving the problems of the ecosystem. And when we say the ecosystem, we don't just mean within Mars, we're talking about every part of the pet journey within sort of the ecosystem. So we take into account pet acquisition when clients are getting pets. What does that look like? How can we help enable that? How do we educate them to a point where they want to seek preventative? So we can prevent disease rather than treat it. Now, I'm a criticalist, so I come from the treating really sick things sort of area. But a lot of the focus of Mars Pet Care is in creating, having our pets be with us and have better lives, longer lives, and really sort of focus in on that relationship between pets and pet parents or their owners, whichever sort of terminology you'd like to use there. So, we do that through all the tools that are available. So right now there's a big focus on data and data management, what we can do with that, using next generation, and the next generation group actually works to do all these with innovative technologies to be able to kind of use that data to make inferences about what problems need to be solved within, the veterinary world. But then there's these ideas of how it gets done and, these really sort of lofty goals. But then ultimately, that's got to translate into pets having a better experience with their owners and veterinarians being able to help work, with clients and pets to make good decisions, throughout their life. And so it's, it goes all the way from, these sort of lofty ideals to practicality and tactics, which, I think is a really, really good mix. And so, we've got our focuses, in a bunch of different areas, but the real crux of it is how we get that done. And it's a pretty amazing thing to be a part of.
It's so amazing. I have like 600 other questions that I want to ask you, but we don't have any time, so we got to wrap up. But James, real pleasure to have the chats to chat with you again. So 2 questions before we wrap up. First is a book, a YouTube, a video, anything that you've read or ingested that you think you'd like to share with our audience.
Sure. Yeah. I mean, I have a ton of them. You can ask all the folks that I'm around. I'm constantly reading about different things, but the book that sticks out with me, I think, that's helped me as a veterinarian, feel comfortable about working with other leaders and, being trying to lead teams, is a book called Crucial Conversations. And Crucial Conversations is a great book to kind of help you get over your own biases when it comes to how you communicate with other people. We oftentimes, we have the exam room nailed, but then sometimes when we get outside of that, it becomes a little bit difficult. But Crucial Conversations is very, very good about sort of mastering your own narratives in your mind. And then it helps you to kind of receive feedback for what it is and then move forward with that. So that's amazing. As far as YouTube videos and everything like that goes, I watch probably once a month, Simon Sinek's, sort of series of TED Talks. And, so the Start With Why idea and Leaders Eat Last is something I really love. And so if you haven't seen that, you should definitely go check that out.
Great recommendations. I had the Crucial Conversations on my list and I just bumped it. So thank you for that. And the second question that we ask at the end, is there an innovator that you would like to recommend for this podcast?
I think there are a lot of them. Ones that I think is pretty amazing is Christian Lutniger. He's sort of one of the developers of PCR technologies, and he is one of the smartest people I've ever met. And I've been around a lot of smart people, and Christian has worked on another level, and he can talk to you about the possibilities of amazing technologies, forever. So he's a great one.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.